Hello, I'm very pleased to be with you to discuss an initiative at the TCU and UNT School of Medicine. I am Dr. Deborah Atkisson, and I'm going to discuss the development of a faculty wellness program using executive coaching skills during the COVID-19 pandemic. My two co-authors for this project are Dr. Jennifer Alley, the Senior Associate Dean of Faculty Affairs at the TCU and UNT School of Medicine, and Myra Giardioli, who is the faculty coordinator at the school. I am, as far as my background, I am an associate professor at medical education. I'm a distinguished fellow of the American Psychiatric Association. I'm a psychiatrist and child and adolescent psychiatrist, and I'm also an associate certified coach through the International Coaching Federation. So when we think about the TCU and UNT School of Medicine, I would like to spend a moment introducing the school to you. We are located in Fort Worth, Texas. We are a partnership of a private university, which is the Texas Christian University, and also a public university, the University of North Texas Health Science Center, who came together to form an allopathic MD medical school. We have a very unique program composed of many components. Our school mission statement really captures that. Our mission is to transform healthcare by inspiring empathetic scholars. And our curriculum covers several different things. Of course, we have all the core competencies that you would find in any MD allopathic school, such as the mechanisms of health and disease. But in addition, we have the longitudinal integrated clerkship. We also have the scholarly pursuit and thesis, which consist of a research project that our students do for 4 years in which they work with the mentor, the preparation for practice, clinical skills, and a compassionate practice coursework. In addition, each student is assigned a coach who works with them during their entire 4 years under the Department of Student Affairs. Our first class, the class of 2023, matriculated in July 2019, and that is quite significant because, as all of us know, 9 months later we had the pandemic. And our faculty were very foundation building for our new school, developing all of the work prior to the first class entering. So I want to talk now about the impact of COVID upon the faculty. This was the stage upon which we set our program. The faculty had to rapidly convert over to online education in March of 2020. They were quarantined at home, and they had to simultaneously provide childcare and education for their own children while they were working diligently to convert all of their work to an online platform. That came with many challenges, a rapid learning curve for Zoom for both the faculty and the students, and they really had to work to engage the students virtually initially. In addition, this was our academic faculty, but in addition, we had our clinical faculty in the longitudinal integrated clerkships who were running clinics, working in hospitals, and they had multiple things to be concerned about. Obviously the pandemic, but also how would they get enough PPE for themselves and for their colleagues. So what we can see is that in addition, everyone was really restricted as far as their interactions with extended community, certainly family and friends and colleagues. And so anxiety developed for everyone. So this was the stage upon which we were going to build this program. We had decided in January of 2020 to build a faculty wellness program before we knew about COVID. And the reason we decided to do that in January 2020 is because we knew from the AAMC Faculty Standpoint Survey, which was conducted between 2016 and 2018, that 43% of all faculty reported being under stress, and of those, 29% reported at least one symptom of burnout. So we were going to develop a program to educate the faculty, to help them develop wellness, to really help with their resilience. And COVID comes along. So we decided we're going to have to move ahead with this, and they probably need it now more than ever. So how did we do this? You heard me mention earlier that all the medical students are assigned an executive coach to work with them during the entire 4 years. Those coaches are housed under student affairs. Our faculty affairs department and our student affairs department, which is where I'm housed as a coach, we worked together and partnered to develop this program. We wanted to really empower the faculty to work on their wellness by educating them about what was happening to them during this pandemic, And also we delivered 4 one-hour sessions and provided education about mindfulness and encouraged mindfulness techniques. And where did we do this? Well, same platform that everyone was working on. We did this on Zoom. 2 of our coaches, and here our coaches are noted here, 2 of our coaches worked with 10 faculty members per cohort, except for the very first cohort, which I conducted in July 2020 with 8 faculty members. So as we began to work in this program, we decided after I completed the first cohort, this might be something that we could research and see if this brief 4-week intervention could be beneficial for faculty. So we developed some research questions. We wondered if there was a significant difference on individual burnout and wellness for people who participated in this program. So we also wondered about individual burnout. Would that decrease if people were in all 4 sessions? And we wondered if it would decrease if people engaged more or less in the virtual community of practice. So how did we do the study? Well, we prepared the coaches by reviewing the curriculum and providing a facilitator handbook. I met with the coaches 3 times to develop all of the interactions that they would be having and to review the handbook and discuss the coaching questions. We gathered demographics of the faculty and results from the Wellbeing Index prior to beginning the 4-week program. We would repeat the Wellbeing Index at the end of the 4-week program, 90 days after the program, and 180 days. This is the faculty wellness guide that I referred to, and in a moment, I'll talk with you about each of those 4 sessions. But before I do that, I would like to state that the program, as far as the research arm, did not fully begin until March of this year. I had done 1 cohort in July. We did a 2nd cohort in October, and we did not get through the IRB process in enough time to begin until March as far as the measuring of data. That being said, we do have 1 cohort which has been in the program, and we have some preliminary data, which I will share with you soon. So in talking about the 4 sessions, the first session is surviving with stress. The goal of this session was to really understand the impact of acute versus chronic stress and how it impacts our behavior by impacting our brain functioning, and how that over time impacts us emotionally and further impacts our behaviors. As all of us know, with acute stress, which we all had at the beginning of the COVID crisis and the pandemic, we have an increase in overdrive, if you want to think of it that way. Our adrenaline elevates. We go into this state of survival. We work very hard to try to stay on top of everything. But after a period of time, that shifts into a chronic stress paradigm, and the hypothalamic pituitary adrenal axis becomes affected. When that happens, we have a number of changes that occur in the brain, and it impacts stress, it impacts sleep, appetite, emotional reactivity, and mood. So we discussed how it was really important to work on your wellness during this time so that you don't get involved in that chronic stress loop. We also discussed in this time the group and how it would work. Everyone was introduced to each other. Many of them knew each other, had worked closely with each other. Although interestingly, we did have clinical and academic faculty blend together, some of whom had not met before. We talked about confidentiality in the group, talked about the ground rules of how everyone would be treated with respect, and that we knew that everyone's wellness needs would be different, and how we were all working together to help each other move towards their individual wellness goals. We discussed how we would be using executive coaching questions as a way to help move the discussion forward, and also as a way to help people think about their own personal goals. And we asked questions such as, what resonates with you for wellness? Where do you want to go with the practice? And we introduced the Wellness Board, which was a team's community of practice that they could use to share information. So in the second week, we talked about coping with stress. And the goal for this session was for each person to develop their own method of using mindfulness strategies. And so we discussed mindfulness strategies after we reflected upon the week, after we asked folks if they had any learning moments they wanted to share. It was interesting because people did talk about how that just contemplating working on wellness had made them more aware of what they were doing that either promoted or did not promote wellness. And then we discussed mindfulness practices, of which there can be many. We gave them simple breathing tools as a point of education, such as using measured breathing. And we asked them to be thinking about what changes were occurring in their day, how this was impacting their functioning at work and in their personal lives, what had been effective for them, how would they like it to be, and where would they go from there. We also asked them to be thinking about what they would be doing for mindfulness for the upcoming week and evaluate the wellness board. In our third session, we measured wellness and resilience. And the goal for this session was to get individuals to focus on their own strategies and identify their own achievable wellness goals. Again, we re-engaged and reflected on the week. We asked people to discuss how the week had been as far as mindfulness. We found some interesting comments. People had practiced breathing. They had done other things, such as taking walks outdoor, pausing, being mindful in the moment, and found that it had been really helpful in lowering stress. We also talked about visual imagery because you see, the reality is for all of us, if we don't know where we're going in terms of how that will look and how to get there, in other words, if we don't have a good roadmap to get us there, we often can't get there. So we did a visual imagery exercise for approximately 15 minutes in which we painted a picture using executive coaching skills of the individuals being at the other side of the pandemic and where they would be at that time. And then we asked them to reflect back on how they got there to give them some ideas. So we asked them what had changed in the past week and if they had noticed if wellness practices were fitting in their day. This is where we began to get comments that people were making a point of doing something for wellness on a daily basis. And people shared that with each other in a very nice, open manner. We asked about, will these things be adaptable long term? And then we asked them what was changing in their wellness journey and for them to note that over the week and follow the direction of the wellness board. And when we went into our final session, which is building a community of practice, we emphasized that they could continue to work together in the team's community of practice after these 4 sessions had ended. We also used this as a wrap-up time period for them to be thinking ahead about what they would need to do to continue their wellness. And we had them reflect upon the series and what had been learned and planned. We asked how far they felt they had come and how far they still needed to go. And we really emphasized to them that this was just the beginning of their journey. We asked for them to think about how the practice of wellness had changed them and how it could continue to change them, and to use the community team's practice as well as the wellness board. So here was our question, does this help? Well, after the July 2020 cohort that I did initially, which is what led us to believe we should try to do a study with this, these were the anecdotal reports. I didn't realize how much I needed this. Practically everyone said that in some way or form. I started looking forward to the hour on Monday. I found myself incorporating mindfulness in small ways, which added up, like putting money in the bank. And I would definitely do this again. So this is what our results to date have been. The first cohort had 8 participants. We've now had a total of 4 cohorts with 23 participants after this one. So our total number of participants are 31 faculty. So one of the cohorts has been in the study and our first rounds of results have returned, which shows that everyone who engaged at the beginning of the study fell on the moderate stress level on the well-being index. They were not receiving feelings of satisfaction from their work, and they were feeling a moderate degree of stress. After the 4 weeks, they uniformly represented that they were having a minimal amount of stress and they were beginning to find some enjoyment back in their work life. So in July of 2021, we will begin our next cohorts. So our conclusions from this study. We already knew that burnout and wellness for medical school faculty has been an issue that's been increasing over time. We've anticipated that COVID-19 has most likely increased burnout amongst everyone. And the faculty wellness program focusing upon using mindfulness and executive coaching skills to help enhance wellness has positively impacted wellness in terms of our initial results. I am very grateful to have had the opportunity to discuss this with you. If any of you have any interest in what we're doing If any of you would like this information to use at your own facility, please contact me. Here is my email, d.atkisson@tcu.edu. And I really greatly appreciate your time today.